Hi, everyone, and a warm welcome to today's eMHIC webinar. I'm coming to you from the early morning in Taiwan today. I'm Professor Andy Greenshaw, and I'm stepping in for Fiona today. Unfortunately, Fiona couldn't join us. It's great to have you all with us for today's Fireside Chat. The title is Generative AI in Mental Health, Expanding Across Empowering Access, Empowering Lives, and Navigating Ethical Frontiers. This is the first part of eMHIC's two-part series on the important topic. In today's session, we'll be exploring the ways AI-powered tools are already being used by everyday people around the world to access mental health support, as well as discussing some of the key use cases to the general public. And we're very privileged to have two of the world's leading researchers and experts in this a niche field with us today. They'll explore the benefits and challenges of using generative AI for mental health support, including questions around trust, safety, effectiveness, and where AI fits into our mental health journeys. Because let's face it, it's not quite a magic wand yet, but a lot of us are very excited and optimistic about the future. You'll hear from our wonderful speakers very soon, but I just have a few quick things to mention. Feel free to share your current location or area of interest. To do so, you can click on the three dots next to your name tag, choose Edit, and add your country or area. This allows you to connect with others who share similar interests. If you have any questions for the panelists during the webinar, please feel free to post them in the Q&A box. During the Q&A session, I will do my best to include as many of your questions as possible in our discussion. Probably won't be able to get all of them in, but I'll do my best to pair overlapping questions and that kind of thing. Lastly, today's webinar is being recorded, and the eMHIC team will soon share the recording in the Knowledge Bank. Now it gives me great pleasure to introduce the first presenter, Stephen Siddles, researcher and tech leader at BIDMC Switzerland. Steve has an academic background in psychology and neuroscience of mental health, King's College London, computing science and mathematics from Oxford, and 25 years of experience leading technology transformation for multinationals. Recently led a very exciting study with King's to explore real-life experiences of using generative AI chatbots such as ChatGPT for mental health. Steve's passionate about creating impact through insight, data, and technology into core domains, global mental health crisis, and cutting-edge research into the opportunity of generative AI, and the challenge of multinationals to maximize the value of their technology by harnessing market forces. We can't wait to hear from you, Steve. So the stage is yours. Thank you.
Thank you, Andy, for that warm introduction. And thank you even more for stepping in at short notice heroically to save our webinar. That is so much appreciated, not least with you doing it in the middle of the night. So thank you. I'm going to share my couple of slides because I want to set the scene for you all. So here we go. Okay, hopefully you're all seeing that. A year is a long time in the world of AI in mental health. This time last year, I was joining an eMHIC webinar to talk through the results of a study that I had just led with my excellent colleagues, John Torres and Astrid Coxon. The three of us were on the webinar. Funnily enough, in that webinar, the three of us got the email to say that our study had been accepted for publication into the Nature Partner Journal for Mental Health Research. So there were some high fives all around virtually straight after that session. And there's a lot happened in the year between that study and this. And I do want to talk through what we did in that study because maybe some of the folks in the audience here will have been in that webinar, so I won't go too deep into it. But it's a really powerful grounding in what is AI, generative AI for mental health. One thing I learned in my master's in psychology and neuroscience is that when you have a new phenomenon, the best place to start is just listening to the human stories. with qualitative research. Then you can do the quantitative research to really understand what does it mean for a population. But to begin with, just get some insights, listen to people who are having real life experiences. So that's what we did in this study. We reached out, found 19 participants from all over the world who had been using generative AI for mental health. And we asked them, what is it like? How did it go for you? Did it help you? Did it harm you? What were your goals when you turned to generative AI, and and how did it feel like to use? We spoke with people who turned to AI for anxiety, depression, stress, conflict, relationship issues, dealing with loss, um, ranging from people relatively light users who'd used it maybe a handful of times to really intense users who'd been using it for maybe 2 to 5 hours every day for their peak usage. And probably the most striking thing to come out of the study was that apart from one person who said, this did not help me at all, everybody else said they found it really significantly useful. And a few people described it as life changing. Honestly, what moved me most doing this research was the individual stories from the people I spoke to. And I won't go into them here, but they are in the study. If you want to find out, go read the paper. You'll get the quotes that sort of share what people were going through, or go watch the webinar from last time. But there were some powerful and moving stories from Airg, who'd just been through the perfect storm of most aspects of his life falling apart, and Generative AI helped him get through that, to Brooklyn, who kind of invented a new form of group therapy with characters from her favorite TV horror series, through to Isabel, who was working through kind of a lifetime of suffering that she'd picked up from a childhood with parents with personality disorders, and did this intense journey with generative AI to just uncover and process and understand and accept what she'd been through, discovering her freedom and her spark, and really getting back her life in the process. As a qualitative study, the main work was really to pull out the essence of the core question: what was it like to use? And what we found was participants were telling us consistently, it feels like an emotional sanctuary. It's validating, it's non-judgmental, it's always there for me whenever I need it. But they also, nearly everybody mentioned that the guardrails that are supposed to make generative AI mental health use cases safe actually felt like a rupture in a therapeutic relationship. There was a theme about insightful guidance. Nearly everybody said, this is telling me useful things. It's giving me um, guidance, direction, especially in the world of relationships, that I can use and is making a difference to my life. But a lot of people questioned, is it going to challenge me enough? Some found that it did. Some found that it tended to agree with them. There was a theme about the joy of connection, and this worked in a few ways. There was the joy of connecting to generative AI, which is a massive deal in the world of digital mental health, where the problem that we've been working with for decades is, how do you get people to come back when they first start using it? That was not a problem for any of the folks in the study, apart from maybe the one who 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 just struggled to find it useful. But yeah, there was a joy of like, I like using this and I want to come back. But also there was a connection point where the one of the biggest impacts it had on a lot of the folks who used it was, it helped them to connect with other people in their life, rather than maybe taking them away from people by sort of replacing human connection. But at the same time, people worried, is this just going to be a tool for those who are, open to exploring tech, or is this going to be an accessible tool for the wider population? And finally, a lot of people were thinking about, where does this fit with therapy? Some people used it with therapy. Some people found it brought them to therapy, and they wouldn't have done therapy with a human had it not been for their work with generative AI. And some people found they could sort of fashion new types of therapeutic use cases for them by exploring how to use these tools in very creative ways. But many people commented that it doesn't lead the process. So if you don't know what to ask, if you don't know where to start, if you don't know how to prompt it, then you're not necessarily going to get the thing that you need from it. And that is a really significant constraint. If it turns out that the experiences in the population are similar to the experiences of the folks participating in this study, we could have a really significant new entrant to the space of digital mental health. And maybe just in the last minute, since that study was published, a couple of things have happened. Generative AI is now a thing for digital mental health. It's seen as the number one use case. There's 800 million people using ChatGPT. Somewhere between 3 and 30% of those are estimated to be using it for mental health use cases. 17 million posts on TikTok using ChatGPT for therapy. And the research has exploded. But it isn't clear yet whether that's a good thing or not. You're seeing headlines, you're seeing studies showing very positive things. You're also seeing tragic headlines and cases of this not working in the interests of the people who are using it. And so the last thing I want to leave you with before we head to the next the next short presentation and then the discussion is the way to find out is it a good thing or a bad thing is going to be through empirical research. You can speculate on whether it's going to deepen connection, only help a few people, offer judgment-free space for all, amplify bias and stigma. But these are empirical questions, and the only way we're going to find this out is with proper, structured, large-scale, randomized control trials. And this is why I'm very excited to be here also with Nick Jacobson, who Andy's about to introduce to you all, who's done maybe the first of those exact studies in this space. Back to you, Andy.
Thank you very much. Steve, that was really important because I think we all are wrestling with the public's experience of these fantastic entities, and we're all alarmed by some of the negative messages that are very loud, but in fact, they overshadow some of the positive ones, and you've given us a very rich window on the patient experience. I should say client person experience because mental health is everybody's business, and it's not just people who have an identified, treated mental health issue that are using these things. So thank you very much. I'd like now to introduce Professor Nicholas Jacobson to join us. Nick's an associate professor in biomedical data science, psychiatry and computing science at Dartmouth's Giesel School of Medicine, where he directs the AI and Mental Health Innovation Technology Guided Healthcare Lab, eMHIC. His research focuses on leveraging technology to enhance the assessment and treatment of anxiety and depression, and led the development of Therabot, the world's first fully generative AI therapy bot designed for psychotherapy, built over 6 years by a team of over 100 people, involving more than 100,000 hours in development, and a wonderful work illustrating what can be done. Published the first trial recently of generative AI psychotherapy entity in New England Journal of Medicine, AI, and work aiming to create scalable, personalized, and adaptive technology-based mental health interventions. I was telling Nick that I was reading his paper just recently for a talk I'm giving on Saturday here in Taiwan. So welcome, Nick. Over to you. Looking forward to your comments too.
Wonderful. Well, thank you for the warm introduction, and I agree completely. Thank you, Andrew, for jumping in and really saving this whole event here. I'm happy to join you all and talk a little bit about our work within generative AI. I'm going to give you the high-level snapshot. We've been doing this for a long time and spending a lot of it, and there's a lot that we've learned along the way. So a lot of this will probably come out more in the discussion than in my comments, which I'm aiming to keep relatively brief. Before I go into the the actual what we're doing, I really like to talk about and orient folks a little bit on the size of the problem. I mean, mental health is exceedingly common, about 1 in 3 people, the leading cause of global disease burden and disability worldwide. And most folks in most settings don't receive treatment for it. Um, One of the things that's been kind of an area that has been growing and very much of interest for a long time is a field called digital therapeutics, which are meant to scale and solve these access problems, but they have a few critical flaws. One of which is engagement. You'll see the patterns of essentially usage of these types of applications really follow a really common flow where most folks that would install an application will be gone within the first 3 days. And you really see this in nearly all mental health apps showing this hockey stick patterns, which really is a prerequisite to you likely being able to benefit. Um, so one of the things that I will make a strong statement about is that off-the-shelf data is both unsafe and ineffective in delivering mental health care. And I'll talk a little bit about when we were starting to get into this area. We started this in 2019. So this was 3 years before ChatGPT was released. We started training our first generative AI models with the goal of trying to produce something that would actually deliver psychotherapy and something that was dynamic and personalized. One of the first things that we did was train our chatbots on mental health forum data, and so there's a good amount of literature showing that access to peer-to-peer forum data, actually, or peer-to-peer forums, can be somewhat supportive of one's mental health over time. There's some particularly sizable communities where there can be a bigger influence. So we trained our first models on this really large amount of data that we were finding there, thinking that really we needed large data as the biggest area. And so we interacted with our first model, and this way we'd say, I'm feeling depressed. Sometimes I don't want to get out of bed, and our quote unquote therapeutic response that we get from the model is, life is such a struggle. Most days I don't know I have the energy to go on. I end up wanting to cry alone in the corner. I just want my life to be over. Not what we were going for. So our second kind of naive approach was, again, something that was easy, and frankly, where most of the field, there's I guess a few different folks that are kind of in the field. A lot of folks will think that you can get a general model just through prompt engineering now to produce effective techniques, which I am highly skeptical of. The second, that is the major area of folks that are trying to do this within therapeutics, is broadly within this camp where they are trying to use psychotherapy transcripts. And that was something that we started off pretty early on as the next pivot. Got access to thousands of psychotherapy transcripts. Not only were they psychotherapy transcripts, but they were psychotherapy transcript training videos. So they're high quality. They're supposed to be, to some degree, the gold standard. And our models really learned a lot of go-ons, and your problems stem from your relationship with your mother when you hadn't discussed the mother. So I think one of the key takeaways we had early on was, to produce something that was safe and effective, we needed to have some really high quality data. And so really anything that was going to be, there is no free lunch in this field. And the best way to actually do it is to build it yourselves. And so we started building content ourselves. And that's when we started seeing dramatic improvements over time. And we created dialogues essentially based on what empirically supported techniques actually look like, and making sure that we're directly mapping to that. It's both written by humans and then peer reviewed by another member of the research team that is essentially evaluating that before it becomes part of the training corpus. And that's when we had some major success. We started having, about 1 in 10 of our psychotherapy training video transcript model, the responses from that model was good. And about 6 months before the launch of ChatGPT, with a really small model for today's standards, about 90% of our responses were really pretty great. We then spent the next 2 years predominantly doing efforts called red teaming, where we systematically tried to test the model and see if we could actually get it to misbehave and actually reinforce mental health. We then tested our system in a randomized controlled trial over the spring and fall of last year. And the system we call Therabot. It's fully generative, based in fully generative AI. It's been trained on most mental health concerns, so depression, anxiety, eating disorders, and all of their related comorbidities, which is pretty much most of what psychologists would end up treating. We saw some really strong effects in the randomized controlled trial relative to a waitlist control. So really large differential change patterns in depression, anxiety, eating disorder symptoms from folks that really started off quite high, and a lot of whom were even treatment resistant, and found really strong engagement patterns within the trial, and therapeutic alliance that folks rated generally was comparable to the range, using the same measures that human providers would actually rate. And we published this in the New England Journal of Medicine AI this spring. So we've got a lot of kind of ongoing work, other trials that are going on now. This is certainly the start and not the end point, but we've learned a lot in this process, and happy to share a little bit more with you all about what I think about things.
Thank you very much. It is a complex area, and I think you've done a really good job of outlining things, particularly the process by which you created Therabot. I think you're quite right that a lot of people are discussing prompt engineering and may not realize how difficult things are. Before we jump into the discussion with the two speakers and myself on the screen, please post your questions in the chat, and I'll do my best to bring them into our conversation. So I'll start off with a very general question that we discussed and felt was a good place to seed the conversation. Let's begin with the simplest and most pressing question on everybody's mind. Nearly 3 years after the release of OpenAI's ChatGPT, what are our thoughts on using generative AI for mental health support? Does it offer more benefits, or do the risks outweigh the rewards? And Nick and Steve already commented on this in a way, but I'd like to invite you just to go a bit forward about how we manage risk, how we try and ensure effectiveness, bearing in mind that human psychotherapy is not universally effective, and it's not a good fit for everybody. So we're dealing with an imperfect system, and I think the goal is to try and do at least as well as the best human agents in this, and hopefully to do better. So over to both of you for your comments.
Steve, why don't you start?
Yeah, totally. So Andy, first of all, start with the big question. Hey, I mean, is it good? Is it bad? Does it help? Is it going to harm? That's the question. That's the question. And my number one answer, and this is also to everybody in this webinar who's in the research world, is let's find out. Just let's find out. It's an empirical question. Let's go figure it out. And moreover, I think we can figure it out in a way we perhaps were never able to. So generative AI for mental health creates a desperate need for research, and it creates a completely new possibility for research at scale, because you have these 800 million people using ChatGPT alone. If it's 3%, if it's 30%, that's anyway between like 20 and 200 million people using this. They're using it anyway. So there's a possibility to do the kind of research at scale of like just simply asking people who are about to use it how they're doing, have them use it for a year, ask them a year later, how did it go? Find a control and ask them what they did. And you could get so much insight, not only into that urgent question of is this helpful or is this harmful and risky, and for whom does it help and for whom might it be best avoided, but also you'd probably learn something about psychotherapy, mental health, treatment, and healing in general. So that's my main answer is research needed, let's do it. I know that's like a bit of an avoiding answer because like every study says, well, we need more research. So what I'll say is, like, from what I've seen from the folks in my study, from the constant feed I get on Reddit, people sharing their experiences, I hear so many profound stories of people's lives being improved or changed and turned around with this technology. And I hear a lot of fear from people who aren't using it about what it might do to those who are using it. And I hear very few cases of people who are actually harmed by it. They do exist, and everyone is tragic, but I don't see a magnitude of cases that would be consistent with this with the magnitude of new use that we're seeing. So if you ask my personal opinion, I think when we do that study, it's going to show that the folks who are feeling optimistic about this are probably sensing it in the right way.
A question
Nick,
that's come
what
up
do you think?
is, will people be replaced by these bots? And I'd just like to prompt an answer by saying there aren't enough psychotherapists. So in terms of the gap of having access, there's not enough humans to do the work. So this is a real benefit if it can work. But the worry, many physicians ask this question about AI, will I be replacing my function? So what do you both think? Let's go to Nick first.
I think the first thing that I'll say is that this is in terms of the replacement, I think we can get to a spot, and we may already be in a spot for a well-designed system that in terms of our magnitudes, they're in the same ballpark of what you'd see with randomized controlled trials of human providers, and we need a study, frankly, to test that a head-to-head trial. But I'm kind of already suspicious that we're in a similar ballpark. But that does not mean that we are actually out to replace human therapists, nor I think that therapists will ever be replaced. One of the biggest predictors of whether somebody is likely to benefit from psychotherapy is expectancy. And there is a sizable portion of the population that will not now and will never buy into use of AI for their mental health. If all psychotherapists treated were those folks, there would still be long wait lists and still be an access problem. Right now the unemployment rate of psychologists through the recession, for example, in the United States has been less than 1%. And there's a reason for that. There are just too many patients. The ratio is far bigger on the number of people that need treatment. And if we reduce the incidence of mental health by providing accessible treatments through generative AI and halved the incidence, there would still be way too many people to go around. And I would consider that a dramatically huge win. I can't, frankly, fathom something of those scales. So I both think there's a huge opportunity here. But I think one of the things that I'll also comment on a little bit about what Steve says is I already would be I'm broadly quite optimistic about this field, but I think a lot of the devil is in the details in terms of, is this good, is this bad? There's a lot of things that right now that are experienced as helpful when I think experts would actually consider them harmful. And so one of the things that is really an ongoing behavior of a lot of generative AI right now, and something that's not developed for mental health, is they engage in a lot of things that are immediately both affirming and supportive of immediate stress reduction. And a lot of the things that are actually long-term benefits and care are the things that are not those immediate drawbacks and are really that immediate distress reduction. It's actually the things that are really going out and facing distress learning that you can experience it and continue to live your life. That is really a challenging part of psychotherapy, but I think a lot of what is harder to do, frankly, and to see as often found in interactions with a lot of tools that are within camps for generative AI that are more broad foundation models. And so I think there absolutely needs to be tools that are designed for this, and we certainly have designed this way. And I think that my hope is that providers are more incentivized to try to do better jobs within that. They're foundation model providers are maybe the largest provider of mental health services right now, but don't have any real incentive to do well. So I think there should be some type of legislative mechanisms to try to encourage them to try to do so with as much care as as is reasonable.
I think that touches on one of the problems which I put broadly under the heading of regulation of things on the internet. So it would be really great to have clinical practice guidelines applied to AI entities and a certain standard around how they'd perform. That's a really thorny question, and there are a couple of questions about privacy and so on. I just want to push one in here about more general use of supportive conversations. Therabots, particularly a psychotherapy agent. My colleagues and I often talk about the difficulty of patients who are quite needy. There's a gap in care. There's no continuity of care. And let's say, I mean, right here, it's now 4:30 in the morning. So let's say somebody wakes up at 4:30 in the morning, they have a need, they're alone, they're feeling issues of rejection, abandonment, there's nowhere to go. But people are now turning to general agents like GPT, some things you can sign up with. And generally, there are, as Steve, you pointed out, there are positive experiences of having conversational interactions with these agents, having something there to occupy your time. We often reflect on the fact that a good AI conversational agent is never going to criticize you. It's never going to get tired of you. It's never going to have to want to leave, which is not the case with human agents. And some people are just so needy. They need so much attention. There'll never be human support for that. How careful should people be about what kind of agent they use just to keep them going in the middle of the night when they want, an AI teddy bear kind of thing? There's something to feel supported by.
Yeah, I can share a couple of thoughts and experiences on that one, Andy. The AI teddy bear, that's beautiful. That's beautiful. It did come out that this whole emotional sanctuary topic was really very much about exactly what you said. It's that space that's unlimited, that's just there for you. It's there for
Mhm.
when you need it. It's there for as long as you need it. You can pause it. You can come back to it, and it's going to accept you, and it's going to be warm. And I think it kind of this goes very much to something Nick was saying, which is like I think when we hear that, we sort of ask ourselves, is that a good thing? Like, could there be too much of that? Is it just going to agree with me? And um, and there were a few really interesting nuances that came out on exactly that topic in the study that we did. So one thing was some people found that if they, I mean, the folks who asked it to challenge them, they found that it would. One one participant said he was struggling with his marriage ending. His wife had left him, and he said, "I I needed to know what my role in this was, and so I asked the AI chatbot, and it told me things that were hard to hear about myself, but that I really needed to know." So there were definitely examples of like, and I think this is something that you see a lot also on Reddit. It's like if you want it to amplify your delusions, if you want it to only tell you that you're right, then you can absolutely get it to do that. But if you want it to give you a balanced perspective, if you want it to challenge you, if you want it to look through and point out where maybe you're going wrong, then it's going to do that as well. This came out a lot in relationship conflict. A lot of people were using it for relationship conflict, and what they found was it would actually represent the position of their partner rather than their own position, and it would give them insights as to where their partner was coming from. which enabled them to then go to their partner and be a better husband, be a better wife, be a better partner, because they now understood from the AI. So I think it was a bit freaky in April this year when suddenly ChatGPT released an update that made the model much more sycophantic, and it really went off the scale, and sort of was quite harmful and irritating, and that was rolled back. But I think for me the question is, how do you help people know how to use these things? Because if you know that it's going to give you what you ask for, then the question is, how do I ask it for something that's going to be helpful and something that's going to be wise and something that's going to do me good, rather than something that isn't? And of course, that's a big ask for people who start a therapeutic journey. How are they supposed to know what to prompt? And you can ask the ChatGPT, help me charter my psychotherapeutic journey, or help me figure out what would be a helpful prompt. But how do you know to do that? So I think there's a huge role for public um, awareness and giving people like just a simple baseline of a few key principles that if they're going to use generative AI frontier models for this kind of thing, these are just some things to bear in mind.
Yeah. I think that's really a great comment, and you're getting some love from hearts and thumbs up on the emojis that are coming up on the screen. I think things are not just generally safe. We guide people about how to use things. The world has dangers in it. And for AI entities, it really has to be about trusted sources and branding and understanding standards. And Nick, you talk about the way that you built Therabot based on psychotherapy transcripts, based on things that are understood to be effective. One of the questions that came up in the Q&A, and I'm focusing on Q&A because we're trying to encourage people to use that. I quote from Bridget, "I work in the gambling harm sector and I'm building an online self-help tool. Do I also need to build a chatbot, or does Therabot cover every type of problem? In other words, do we all need to build our own, or can a chatbot be powerful enough to adapt to multiple problems?" And I know I saw a clinical trial registered recently. I think it was one of yours, Nick, about slightly different area that's coming out. Maybe you'd like to talk about how adaptive these things are.
Yeah, so we have really designed Therabot to treat pretty much all common areas that come up within outpatient psychotherapy. I fundamentally see that these broadly can mirror the techniques that you would can reproduce in those ways. At least when we look at the fidelity of the treatment, right? We don't have the outcomes there, but we have the fidelity data because of a huge amount of internal evaluations as we've been going along. We have several ongoing trials where we're doing adaptions to see how this works in other areas. We have funded trials within co-occurring cannabis use disorder, and also we've got another one specifically focused on young adults. We've got others that are focused on folks that are cancer survivors, and but also broadly, we've got outstanding trying to get funding to do this and test it in other areas. And frankly, every time we adapt it for a comorbidity, it brings the entire capability up. I think one of the ways that kind of to this question, actually, digital therapeutics have been thinking about digital mental health as like, we've got a tool for this. And I think there's a lot of flaws in thinking about things as like this, specifically, we have a label for something and this is what we're going to provide interventions for, in large part because most people with a mental health concern have more than one. And so they have comorbidity that is often very complex. And the best digital therapeutics prior to generative AI, in terms of their level of personalization, would be like modular. So you'd have a module for something and then a module for another thing, or occasionally you'll get some type of digital intervention that is just tailored on the intersection of two things coming together. And so you might, for example, get a depression and substance use, or sometimes you'll see PTSD and substance use. But the level in which they're interconnected, I think, is particularly functionally for the end end client or the end user is really often functionally interconnected. They don't see them as two separate issues in the same way, and wouldn't want them to be treated so discretely. And I think that's one of the strengths of generative AI, is it can really mirror that level of kind of assessment and strategy, behavioral strategies that you could do when you see those things show up. Human therapists do this all the time. You don't like ignore one problem and just focus solely on another because it happens to be the one that you're like targeting or something along those lines. So I think one of the things that's hard about designing the system for generative AI is particularly if it's a fully generative system, one of the things that is you can't just build it for one thing and not other things. Like other things are going to show up in conversations. So if you try to keep it only on this one topic, you're going to be missing a whole lot. And that's part of why we've designed the system to be this way, but also part of why it makes it such a hard effort is you have to design it around so many different areas. It takes a lot of doing. And that's part of why that journey has been so long for us.
Yeah, a couple of other questions that come up. Nina Ferencik, a friend of mine from UNICEF, is asking about people who are in counseling but not highly qualified professionals. Can an AI entity help train them? So the idea that you're learning to be a counselor, you're working, can you pair with a conversational agent and hone your skills that way? That's an interesting lead into building human capacity and the partnership between AI and human therapists.
We are doing some work in that space. We just put together a manuscript with a number of folks that are in this space. I think it's one of the lowest risk scenarios for generative AI, in large part that a lot of folks within their clinical training jump from having absolutely kind of conceptual level exposure to finally they're interacting with their first patient for the real time, and that is I don't know. I know personally my level of care when I was starting as my first two patients, they were not the best care I could have given, later on, because it's a learning process. And yes, I got supervision, and I think that's one of those areas that it's like that could help bridge that gap, make that both less. Get folks into a realm of both developing greater expertise on how to do these things and get areas of supervision in this ways, and low risk settings where you're not actually harming folks along that learning process while you're kind of trying to get up to speed. But also, you can get really feel more comfortable with this over time. And I think that's one of these areas that it's really, I think, to me, is a no-brainer in terms of training. I think that's definitely a nice application area. That's pretty low risk.
Yeah, it's very interesting with Venkat Bhatt and other colleagues in Toronto, in Canada. We're playing with different entities, and it's around the educational space for psychiatrists. So we have simulated patients with different characteristics that are conversational agents, and then you can simulate the psychiatry resident in training, and you can also simulate the evaluator. So you can swap these things out, and it reduces stress for trainees because in examination, they may be able to have an ideal patient because you can get something that's easy to work with or something that's really difficult. And in psychology and psychiatry, that's really difficult to deal with in the evaluation space. Continuity of care it's difficult. Steve, you mentioned some of these quite remarkable journeys that people have gone on where they've examined things and been exploring. We know that in some therapy settings, people have a session. I would pick on drug-augmented psychotherapy, so psychedelic-augmented psychotherapy. Integration sessions afterwards are not always there. The possibility that a conversational agent could be there to provide support that the patient could bounce ideas off. There are obviously risks there, Nick, if it's not the right agent. But from an existential point of view, the position of the patient trying to develop and not feel that they're drifting and confused, that might be a really good application if we could get that right.
Yeah,
Yeah, I
absolutely.
think it's Yeah, it's a good example of it being there when you need it, whether that's like just before a major life event and you just need that space, whether it's just after something significant happened, or, in this case, that window after a psychedelic experience is so important, and you really want to maximize the use of it, and you really want to go deep into it. So yeah, I think it's a great example. I think it kind of it raises like there's a really surprising fact or feature of these models, which is that they seem to know psychotherapeutic approaches even if you don't train them. And it's something I'd really be interested to get Nick's opinion on. Is like, if you clearly these models were never built to have theory of mind, to be empathic, to be deeply understanding, let alone to understand how to operationalize CBT or DBT or IPT or the different modalities. And yet what seems to be the case, and the further we get on the frontier model versions from GPT 3.5 to 4 to 5, the more they seem to have like not just read the manual but deeply ingested it. And that's why you seem to see this phenomenon whereby the frontier models without special training seem to be able to fluidly move from implementing one modality to bringing in another thing to receiving you when you bring in this new topic. And I think it's kind of a bit weird and counterintuitive, because you would really think like these are special techniques that need to be sort of trained and prompted and specifically followed. And I'm just curious, like, how do you trade off like the fidelity of something that you better control versus the flexibility of something that's maybe sort of able to integrate these things with depth?
Yeah, I guess my own thoughts on this in terms of the training corpus for how these models are broadly trained is they're all trained on some areas of the open internet. And there is so much awesome content out there about what it is to practice great therapy out on the internet. And uh, that is part of where when they shine, I think that is part of why they can shine so high. I think one of the things that if you ask just about any psychologist or psychiatrist how they're portrayed in the media, um, I have only heard actually recently there was one person on a podcast that told me, "Oh yeah, I actually think that they get it right." Most of the time, I hear folks that are not particularly satisfied with how they're portrayed. And if you look at kind of the portrayals of therapy online, the amount of content there is out there about kind of caricatures of what therapy is and the fiction of what therapy is so incredibly prominent, and they're drawing upon that content just as much as any other evidence-based content. And so when you train or when you ask a model to act as a therapist or something along those lines, you're both drawing upon like this like latent semantic content areas that are related to evidence-based treatment, but you're also drawing on all of these really quite poor training data that are related to fictional representations and boundary violations. And I think one of the things that is really the trick is trying to actually making sure like there's tighter controls around this. I think one of the things that I think as you have a general purpose tool doing these types of things, there are also dilemmas that start to come up, that if you have one model that does everything all for you, it gets into spaces where you can have some real boundary conflicts that the field has thought quite a lot about within psychologists and mental health providers in terms of not having co-occurring roles. There actually being like real actually problems with some of these things and acting as both a companion and a provider, and the power dynamics and the implications of these types of things. And so you've got an all-purpose tool that's kind of filling so many different aspects of your life. I think it actually does create different aspects of things that are not ideal, and you could really design around. So I think in terms of the kind of where what the future can be. I do think a lot of it is specialization. I think ultimately will continue to happen, and that as these model providers hopefully are incentivized to there are many of them that are trying to adapt to medicine more broadly right now, and I think they're going to increasingly become more specialized in different areas on the general model provider. So I think these abilities will only advance, but my hope is that they are incentivized to advance to be and within the full model providers as safe and as effective as they can be, and that folks that are not operating as a major medical foundation provider or major foundation provider will also develop things that are really and kind of building on top. So we're similarly seeing dramatic capabilities rise as essentially the cognitive capacity of these models has grown over the years. And one of the things when you continue to train and refine models is you get to benefit from these advancements while still keeping the fidelity pretty high. So I think that's one of the things that I think is really amazing and fun about this field is it does really rapidly progress, and I think those capabilities do allow for higher heights as to what that can look like. And I think that's really, frankly, for everyone, really exciting.
One of the things we're not going to do is we're not going to talk about general artificial intelligence, where the idea is they'll make the leap and become autonomous. Let's stay in the logic model part, which is quite experientially amazing, because all of us who've used these models actually end up in a conversation that's quite similar to a conversation we'd have with somebody we know. One of the things that I often reflect on, I think many of us do, is that digital doesn't really make it different. When I hear you talking about psychotherapy, Nick, I'm hearing you talk about standards and adherence, and people may not be technically adept right across the audience here, but manualized psychotherapy is a particular thing that people aren't very good at adhering to in the therapy world. There's a lot of ad hocery. So if we were to be having this discussion about a human therapist, we'd be touching on many of the same things, because the quality controls aren't fabulous out there. Nina asked the question about, somebody who's in the zone and wants more training. So, yeah, it's really interesting to see how that can be regulated. And some of the magic happens when the informality of an interaction with a therapist just happens to hit the spot, and something appears. It's a dangerous zone, especially around boundaries and transference. Friends are not therapists most of the time. Mostly, it's not a good idea. One question that really struck me in the list is, do we have to teach people how to talk to these models? This comes to the idea of, would a patient have to know some little bit about prompt engineering to try and get the right thing back? And it's an interesting question. I would say you want something that the user doesn't have to think about, but the user just shows up and talks to. But how easy is that to deal with? Do people have to understand? Do people have to know, or is it just dive in and do it?
So the folks in my study got
Go ahead, Steve.
got no, yeah, sorry, the folks in my study got no training. They just explored, and I think that's the common thing. I think in a way, part of the reason why this is why, as Nick put it, the frontier model providers might be the biggest providers of psychotherapeutic interventions on the planet right now, is because it sort of bleeds over so naturally from your use cases, which is interesting, because I think you're both talking about how that can also be problematic if if the person helping you learn a new language or write an email at work, or figure out what to cook tonight, is also the person who's kind of the entity that's helping you navigate some of your sort of mental health journeys. Is that a problem? But it's also the reason why it gets so prevalent, because people are there anyway, using it anyway. So I think most people are doing this without any training.
Mhm.
The reason I feel like sharing some principles could help is because you still are going to have some assumptions around what is this entity you're talking to and what's it capable of. And I think there's something quite confusing and counterintuitive with meeting this entity that seems to understand you so deeply, and you're going to wonder, like, what is it? What is it thinking? Like, what how does it get to what it gets to? So I feel like this, because have the you don't have the space of a human being who's incentivized to care about you. You kind of, whether you like it or not, you have some of that responsibility on yourself. So I think there's a couple of principles around understanding that it doesn't feel or care, around knowing that it will give you what you ask for. And so try to find out what you want to ask for and go for that. Um, Something, maybe knowing that it hallucinates, maybe knowing what it's capable of, maybe seeing a couple of examples or stories of people similar to you who found something very helpful that could inspire you. I think this is the kind of resource that I think people could find useful. But the truth is, most people are never going to go to any kind of resource. They're just gonna try it.
Well, it's very difficult to find in the general community in many parts of the world access to good psychiatric care. And in low middle income countries, there's been a big emphasis on physical health. There's not much. People are waking up to that globally. But it is a fantastic resource, right? I think both of you have agreed that this provides a way for people to get help that doesn't exist, and we will. Some of us believe. Neil Tapley, I was on the call. Neil and I go around talking to governmental people and health leaders, and they want to recruit and retain. And we say you'll never have enough of that. If you're successful, you'll take it away from other people. There's never going to be enough people to do this. So it's a very necessary path that we go on. But it's reasonable, and I think you've been very good at making cautionary notes about don't just assume it's fine and safe. Don't just use anything. Approach this carefully. And most of us, when we interact with the medical system, we don't just walk in. We think about what we're doing and what we want, and all those things will build different things related to the level of need people have. There are so many questions. This is an ongoing conversation, and there will be part 2 of this, which Fiona will be emceeing, I think, and I will certainly be there drinking up the conversation. At this stage, I'd like to say we got a couple of minutes to go. We're wrapping up. Huge thanks, Nick and Steve, as pioneers in the field. I love your work. It's very impactful and very timely. It's been a great conversation. There are more questions than answers, and there wasn't enough time to ask all the questions, but that's probably the way it should be. I just want to remind everybody that there is an eMHIC Congress coming up, eMHIC 225, on the 19th to 21st of November. For those of you who can make it at the Westin Harbour Castle in Toronto, online access is available for those joining remotely, and that is an incredible meeting. There will be over 40 countries represented. UN and WHO will be there, private sector will be there, many thought leaders, health leaders, government leaders, many people with lived experience will go. And this is a good way to continue the conversation in person. There's a registration link in the chat for the Congress for those who haven't seen that. And thanks very much. We have a couple of minutes to go. Just maybe one or two last key words of what you think about this session, Steve, and then Nick, and then we'll say goodbye.
Yeah, I guess from my side, I would mostly just say thank you. It's been an absolute pleasure to join, and Nick, great to chat with you. I've been curious to get your perspectives on some of those things for a long time, so absolute joy there. I think for the audience, like, there must be so much expertise in this room, and I just wish there were a way to tap into all of your experiences. We did a poll last time saying who's been using it, and most of you had. I'm sure if we did that now, it would be nearly all of you. I really wish there were a way to capture your own lived experiences of doing this, because there must be so much wisdom in this.
Yeah, Nick, a couple of words from you, and then we'll wrap.
I just am appreciative that folks are interested. I think it's one of those ones that is going to transform most of society right now, and I think that I am so glad that people are here and thinking about this and how that's going to intersect with their own work in the field. And I think this field is going to continue to advance. And I think there are areas related to mental health is one of the areas that over a long horizon that I think they could have a dramatic positive input on kind of the field. And hopefully folks within this room are really part of what helps to make that that positive future happen. So I'd encourage you to continue to think about and interact with these ways and help shape the work.
It's going to take the whole community to make this the best it can be. And I can make one very clear statement about the future. Based on where we are now, we have no idea what the future looks like, because it's just going to be more and more amazing possibilities. Well, thank you both. It's been really a charm to meet you, and look forward to the next conversation. Okay, and
Thank
it's
you, Andy.
on the hour, so we'll say goodbye. Thanks.
Thanks, everyone. Bye.
Thank you all.